In this presentation, you will learn how to speak dementia. Communication is really essential in providing care and support for someone with dementia. Here you'll learn specific techniques and communication strategies for working with dementia sufferers, and you'll learn how to approach someone with dementia and how to utilize all their senses to communicate with them. My name is Benjamin Pierce. For more information, you can visit my website at planetbenja.com. Communicating with a person with Alzheimer's disease, and these also apply to people with dementia. Communication is essential in providing care and support. Caregivers can sometimes become friends to the individual with the disease due to old friends disappearing. Here are the 6 basic principles of communication for establishing a meaningful relationship. Number 1, a willingness to become involved with the person and to know their life story. Number 2, to convey a positive regard for the person. Number 3, to speak to them as an adult and not a child. Number 4, to develop an atmosphere of acceptance. Number 5, to have a desire and capacity to listen. Number 6, to communicate empathetic understanding. And number 7, to be real. Listening. It all starts with listening. One does not just listen with their ears. He listens with his eyes and with his sense of touch. He listens by becoming aware of the feelings and emotions that arise within himself because of his contact with others. He listens with his mind, his heart, and his imagination. He listens to the words of others, but he also listens to the messages that are buried in the words or encoded in all the cues surrounding the words. He listens to the voice, the demeanor, the vocabulary, and the gestures of the other. He listens to the sound of the silences. This is how people with dementia may feel. No theory of medicine can explain what's happening to me. Every few months I sense that another piece of me is missing. My life, myself, they're falling apart. I can only think half thoughts now. Someday I may wake up and not think at all, not know who I am. Most people expect to die someday, but whoever expected to lose their self first? So what about me? It's a funny cartoon my sister sent me. When I learned you are what you eat, I realized that I might be nuts. A person with Alzheimer's disease can't change. They can't alter their perception. They have a different state of reality than what we may experience. So in order to deal with them and communicate with them, we need to meet them on their level. We need to change. Let's explore the brain function and how that might affect dementia. The hippocampus is part of the forebrain, located in the medial temporal lobe. It belongs to the limbic system and plays major roles in short-term memory and spatial navigation. Fully developed in females by the age 18 and in males by the age 25. It's the first part of the brain that's affected by Alzheimer's disease. Without a fully functional hippocampus, humans may not remember where they have been or how to get where they're going. It's often been said about the disease that we're an adult once and a child twice. Stage 1, early stage in Alzheimer's, you can think of them as a young adolescent, and encompassing ages of perhaps 5 to 11. Stage 2, think of them as a toddler, age 2 to 4. And stage 3, end-stage dementia, you think of them as an infant. Let's explore some communication techniques. It's important to use concrete words. Put that over there may be confusing to someone with Alzheimer's disease. Instead, say, put the newspaper on the coffee table. Avoid open-ended questions. It's better to substitute questions that require only a yes or no or short phrases. Identify yourself. Make sure they know who you are. Use eye contact. Use a very calm voice and eliminate distracting background noise, such as TVs or music playing. Use short sentences. Use one-step commands. Ask yes or no questions, and also use word cues. Allow time to answer. Don't rush. Use demonstrations like pictures in magazines. Talk about real things, not abstract. Try to avoid what-if scenarios. And don't project into the future. Deal in the here and now. Repeat using the same words over and over. Offer acceptable choices. Keep it simple. Don't make things too complex. Pick your battles. Be patient and don't rush the person. They need a few extra seconds to process your request. Cloak your own personal problems from your care recipient and try to mask your frustration because people will pick that up. The reality is that when diagnosed with Alzheimer's, we're often discounted. Our views are discredited because of the disease. Make sure the person is ready to communicate with you, that they have their glasses, their hearing aids, their dentures, that any glare is eliminated, background noise is eliminated, such as radio or TV, and seating is comfortable. The key here is anticipating their needs. Don't put them on the spot, but do make them part of your conversation. And don't talk about them to someone else in front of them. Pay attention to your approach. Address them by name. Identify yourself every single time you meet with them. Don't quiz them. Approach the person from the front at eye level. Don't hover over them. Don't approach them from behind. And don't shout across the room. Establish eye contact and be patient. The key here is use common courtesy in active listening. Use all the senses when you're communicating. Vision. Watch your own facial expression. Smile. Smile disarms people. Watch your body language. Be warm and inviting. Hearing. The tone of voice can project support or rejection. Try to use calm, clear, low-pitched tone of voice. Talk slowly and be patient. Touch. Touch is a very powerful communicator, perhaps the most so. Handshake, touch on the arm, holding hand, a gentle massage on the shoulder, and even a hug if appropriate can all communicate warmth and acceptance. Truthfulness may not always be the kindest response. Confronting a person with dementia with a reality such as the death of a spouse or loved one may actually be cruel. Forcing a person with a memory problem to face the truth could cause emotional pain. It's better to validate the feelings that a person is expressing rather than to make them face a reality that is totally gone from their memory. It is critically important to treat people with dementia with a sense of dignity. Don't treat them like children. Don't talk in condescending manner. Don't talk in a controlling or commanding manner. And don't talk about them when they can hear about themselves or others. Many people with dementia have undiagnosed pain. Often they cannot communicate the pain that they have. It can be very distracting and can trigger behavioral problems as they attempt to cope with it. It can cause loss of appetite and weight loss. It's extremely difficult to diagnose. The most common source of this pain is arthritis. Here are some typical dementia symptoms that present themselves early in the disease. Short-term memory loss, word-finding problems, asking the same question, denial, difficulty making decision, paranoia, and agitation. Let's go through each of them and I'll offer some coping strategies. Short-term memory loss. Short-term memory loss is normally the first symptom noticed. Patients become forgetful, they lose things, they have trouble remembering even the most recent events. Establish a routine and provide written daily agenda such as notes or a special calendar. Leave items in plain view that are used daily such as hearing aids, glasses, so they can take advantage of the visual cues. Avoid questions that test their memory such as, what did you eat for breakfast? Or didn't you pay that credit card bill? These only serve to make them more painfully aware of their loss. Word-finding problems. These are common, especially when they become fatigued or emotional. Supply the word if she can't. If they lose their train of thought mid-sentence, tell them they can come back to it later. Preserving the patient's self-esteem is critical. Some people may have difficulty following instructions or complex concepts. Use short sentences and visual cues. Never assume that they have understood everything you've just said, even though they're nodding in agreement. There's two types of aphasia. Expressive aphasia is the loss of ability to speak coherently, even though they may understand everything. And receptive aphasia is the loss of ability to understand what is being said. Processing of both speech and understanding slows down with dementia. Many people will ask the same question repeatedly. It's quite common, and it indicates that they're trying to remember something that's important to them. Be patient and answer the question as if it was the first time you've heard it. If the information is critical, jot it down on a 3x5 card and put the answer on the back. Denial. Denial is a common coping mechanism and a natural way of self-preservation. If you want someone with dementia to admit that they have it, they need to feel safe, supported, and that they have some control and say-so in their future. Resist the temptation to convince them of their condition. They're more likely to respond to emotional support and opportunities to talk about their fears. Difficulty making decisions. Changes in the brains of early-stage patients cause impairments in memory, reason, and judgment, rendering it difficult for them to make decisions. The limbic system in the brain is in charge of transferring information into memory. Many people feel overwhelmed when asked to make choices, causing them to feel ashamed of their condition. So just limit situations where the choices that they make are necessary. Limit choices. Would you prefer the grilled cheese sandwich or the tuna sandwich? It's easier for people with dementia to answer than what would you like for lunch. This way they still have input and feel involved, yet can answer the question without being forced to come up with an answer to something that might be beyond their ability. Paranoia. Paranoia is common in the disease and results from damage to the part of the brain that separates facts from fiction. It is also a way for the patient to avoid the painful realization that they have Alzheimer's disease. You will not convince an Alzheimer's patient that someone didn't take his wallet, so don't even try. Respond to their feeling behind the paranoia. Help him look around for it. Have extra sets of keys or eyeglasses available, and even perhaps an extra wallet. Put a care plan together that can be agreed upon early in the disease process that you can refer back to. Also, it's important to avoid denying their reality. Try not to react if you get blamed for something. Agitation. Here are some possible causes. Sudden change in a well-known place, routine, or person. A feeling of loss. For example, the person with Alzheimer's may miss the freedom to drive or the chance to care for children. Too much noise or confusion, or too many people in the room. Being pushed by others to do something, for example, to bathe or to remember events or people, when the Alzheimer's disease has made the activity very hard or even impossible. Feeling lonely, not having enough contact with other people, and also interaction of medicines can cause agitation. Here's some possible solutions to consider. Reassure him or her. Speak calmly. Listen to the person's concerns and frustrations. Try to show that you understand if the person is angry or fearful. Keep well-loved objects and photographs around the house. This can make the person feel more secure. Reduce noise, clutter, or the number of people in the room. Try gentle touching, soothing music, reading, or walks, even aromatherapy. Build quiet times into the day along with activities. Limit the amount of caffeine, sugar, and junk food the person eats and drinks. Finally, it's important to take care of yourself. Don't let the caregiving turn you into a patient. Ask for help when you need it. Join a caregiver support group. Take breaks each day. Try to spend some time with friends to get away from it. Keep up your hobbies and interests. Eat healthy foods. Get exercise as often as you can. Don't neglect your own health and see your doctor on a regular basis. Keep your health, legal, and financial information up to date. Here's some reference material that was used in the development of this presentation. This has been Speaking Dementia. My name is Benjamin Pierce. For more information, please visit my website at planetbenja.com.